Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. Now today is day 8 of New Zealand lockdown time, right? In this live video, I'm going to show you how to use acupressure point to treat your upper back pain. Now, first, we're going to talk about where exactly is the pain, right? One of you asked me, actually sent me a message and asked me that to do this video because I think one of you have upper back pain, and the upper back pain is called one of the point called Gao Huang over here. This point called Gao Huang point. When point over here is just right next to the scapula, right? And that point is difficult to treat. To be honest, it's very difficult to treat, right? But the acupressure point I'm going to show you, it may give you instant relief. If it does give you instant relief, then you just need to keep going every day, massage the acupressure point, and I believe you will get the best result that you ever will get, right? So let's talk about where the pain is called upper back. Yesterday we did a video about sciatic pain, and the day before we did a video about lower back pain, right? And the day before we did live video about neck pain, right? Now today is upper back pain. Now a lot of time the upper back pain is actually come with neck problem as well as neck problem. So just for a memory, the neck problem is over here. You do the acupressure over here, right? So when you do the acupressure over here for your neck, if you have upper back pain, then yes, this is the video that for you today for upper back pain. But again, if you just watched, it's the first time for you to watch this video for upper back pain, you do have upper back pain, then when you do this video, you want to go back to previous video to look at how do you do the pain, the acupressure point for your neck pain, right? Upper back pain is over here, right? Whether the pain is over here, in the middle, over here, or here, on both sides, right? And this acupressure point gonna work for you. Now, if you're an acupuncturist that you're watching this video, live video, that you know the meridian over here involve 2 meridian, small intestine meridian. Maybe if pain over here, it's actually gallbladder meridian and bladder meridian as well. Okay, if you're not an acupuncturist, you're patient, or you just suffer from upper back pain, or your family suffer from upper back pain, right? You don't need to know what meridian it is, because what I'm going to show you today is you just massage that area and it cover all the meridian, right? And what you're going to do is just give me your hand, and you can do it with me, right? So that's your hand. That's my hand. Either side, okay? Just to one side, either side. There's your hand. From the wrist, right, to the elbow. Just do halfway. Right, this is halfway. I'm gonna use this hand. This hand will be better. I have 3 cameras in front of me, right? Just to let you know that why I have to adjust my arm, because one's on YouTube, one's on Instagram, on our Self-Balance Instagram page, on one of our YouTube channel, and as well as Facebook, right? So I have 3 different cameras in front of me. Then, so between wrist and elbow, halfway. Give a halfway. So on your palm side, right? Don't do it on your back. It's easier to do it here, right? Over here, right? So you're gonna massage, you can do the acupressure point from here to here, but mostly you'll be up to here, right? But anyway, I want you to do it from here to here because it'll cover the whole upper back rather than just one point, because you're not an acupuncturist, you don't know which meridian is gonna help, which point is gonna help. If an acupuncturist, it's easy, right? But if you learn balance method acupuncture already, then that's easy, right? You can target the point directly and go into it. But this acupressure point is actually for people that don't know about meridian, but you just cover this area, and when you get the acid point, which is when you get the sensitive point, you just work on the sensitive point, and therefore you will get a good result for your upper back pain. You'll get relief. We're talking about instant relief, right? Now over here, can you see halfway? So you're gonna do from here or here, right? Or here. So over here, I want you to do the same technique as last few videos. So you're gonna use index fingers. So bend your index fingers and then use your thumb to support it. Here you go. All right. So then you're gonna use over here to massage it. Okay. And secondly, you can use make a fist first, and then use your thumb, the tip of your thumb, and actually press it over here, index finger. Then you use here, okay, to press on the point. And here we go, start. So again, you're gonna do from here to here halfway, right? So over here you have 3 meridian, 1, 2, 3. Right? I want you to do 1, 2, 3, and as well as between 1 and 2, there's another line. Between middle and the side over here, there's another line. So amazing that there's an image over here. There are 5 different invisible lines. From here, 1, 2, 3, 4, 5. That's how many meridian that you should do. All right. So get you can use your knuckle, index fingers, and press it and rub on it. Okay. Press and rub. Use the same pressure. And when you do, if this is when you're testing the point whether it's sensitive or not, give it about 3 seconds. Press it and rub it. 1, 2, 3. If that is no sensitive at all, move to the next point. So when you move, this is the first point. When you move, don't move it too far. Okay, step by step, point by point. Right, move to the next point over here. Rather than point here, move to here. It's too far away. There's another point that you missed over here. So move it slowly. So press it and rub it. Oh, that's a bit tender. So count to 30 seconds. Work on there for 30 seconds. Then move a little bit down. All right. If there is no tenderness, keep going. I don't feel anything in here. Keep going. Oh, there's a bit tender. Then give it about 30 seconds. That's it. Simple, right? Okay, keep going. No, not 30 seconds, yo. I do a bit faster. All right, just like that. Keep going. I don't feel anything. Oh, I feel a little bit in here, so I keep going for about 30 seconds. Let's make a line of it. So from here to here, halfway. We're gonna do it halfway here, right? So I've got it in here. The reason I want you to use knuckle because there are a lot of points. Knuckle is stronger than just your fingers tip. You know, if you just use your finger tips, the thumb tips, the tip of your thumb, you're gonna feel pain very soon over here, okay, in the joint. All right. If you have arthritis, stiffness, or pain in your hand and your fingers, then the best way for you is you need to get a device. Will I have it in here or not? Yeah, something like that. Right. Now you can go and buy it if you're interested to buy one. We sell this in our clinic. Right. You can contact us. We can send it to you. But at the moment we can't send anything else. So using this is quite good as well. So like this. Okay, I don't have much tenderness spot. This is one of them. So do 30 seconds. All right. So the next one you go to is you go to the middle between here and here. And now we know this is the middle, and there's another point over here. So you could work on here. So slowly go to every point, you know, down to here. Down to here, then you go to here and test it again. I'm not gonna do it 30 seconds for you, all right? You know, I'm gonna show you where you locate it, all right? And do all this. Now, remember when you do this, you test it out, 3 seconds. Now this is a bit tender for me in here. I can do 30 seconds over here, all right? So you may, when you press, especially in the middle, when you press it, you may get some numbness over there. And that's normal, right? Or sometimes you do over here, you get numbness over here. You pinch a bit of nerve, and that's okay. Don't do it so hard on it. When you get the nerve, just don't do it so hard. You keep massaging it because that's gonna work even better for you if you get those points, right? Over here, that I can feel it up tingling down up to my arm because I got the nerve over there, and that's okay. No problem at all, right? Just keep working on 30 seconds. And once you go to here, there's another point over here that is on the corner of here, and in between here, middle point, and here, there's one point over here. So get to that point first, and again, slowly work down to the middle. Slowly work down to the middle. Then, I got someone on my Instagram, the Acupuncture Clinic. How are you? Thank you for joining my live video. And I got someone on Facebook as well on YouTube. Thank you for joining this live video. And please share this video to your friend, and they can learn some acupressure point for the upper back pain. We're talking about upper back pain right now. So all this point. So you might, once we finish this live video, you might rewatch it to see how you get to the point, you know, where I actually treat. I'm actually treating all this problem, okay? And you don't need to know about meridian at all. You don't need to know about meridian exactly where the point is, because what I show you all this point over here, it's going to relieve, target all the problem over here, all right? Target all the problem over there. And what you're gonna do is just follow me to get to the answer point, which is the most sensitive one, okay? So what your technique is, you can use your knuckle, index fingers, or your thumb over here. Then you press over here to test it out and which one is sensitive. Any tenderness spot or sensitive spot, all right? If you do it, if you get, when you test it out, you do 3 seconds. Press it and rub it, 1, 2, 3. Okay, nothing. Keep going. Press it and rub it, 1, 2, 3. Nothing. And press it. So you want to move slowly, point by point, all right? Nothing. 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 Okay, a little bit sensitive over here, a bit tender over here. So you're going to press it and rub it, 1, 2, 3, up to 30 seconds. Up to 30 seconds. Right? When you go to after 30 seconds, you move to the next one and test it out. 1, 2, 3. Oh, that's a bit tender as well. So up to 30 seconds. Simple. It's so simple. This technique is so simple. When you get the sensitive point, the tightness over here, which means that you have the tightness on your upper back. And when you release here, that is a small image of your upper back, right? and when you release here, I'll tell you what, when I do it for a patient, they can feel warming sensation on the back. Why is that? Because the circulation become better on the upper back, right? That is how it works, okay? With the acupuncture, we know you have local balance. You can put needle on the local point, and you can, it's a massage therapy. They always, when the upper back, they massage over here. But there is another theory over here is once we know how the meridian connect to the entire body, we can use distal acupuncture point to put needle over there to get more circulation over here. And that's how it works. It can relieve the pain over here. Then when we know where to put needle in, we can, needle is just a tool to treat it, right? You can go without needle. You can do acupressure point on the same point, and that'll work as well, right? It doesn't work as well as needles, but it works. So when you hit it, you just massage it, right? So from here to here, there's 5 different meridian, 5 different line, invisible line over here. You just need to cover all the line, all right? Step by step, all right? You can rewatch the video if you just get into this live video. You watch it and then start it from here to here, all right? Now, again, that is only for your upper back, right? If you want to get to your neck problem, you need to go to the previous video to work over here. So you can combine the point over here and here together to treat, to help your neck problem and as well as upper back. So if you have your family member or your friends, your mother, your daughter, your wife, your husband suffer from upper back pain or neck pain, hey, share this video with them or tag them on my Facebook, right? And so they can watch it and they can learn it from themselves. Or when you learn it from yourself, if anyone, your family members or your friends, they have upper back pain, just try it out. Try it out to do all this one. It does take time. It does take time, but that is something that you can do while in the lockdown time, while coronavirus going, and you can't go out and you get a acupuncturist, get a massage or whatever. You can't do anything for it. Then this is the best way that you can help yourself at home, right? Now, get a heat pack on top as well. Put a heat pack in there. It'll help you as well, okay? It doesn't mean everyone will get relief. If it can't get any relief, which means those are not strong enough for you, or you may have a structural problem. And there is some structural problem, and you do this point, you get relief as well. But you get better and better, and then it can't get any further. When it can't get any further, there is on this point, you need someone to help you, which you need a professional. You need a chiropractor, osteopath, physiotherapy, or like acupuncture for you. So the information is on Facebook, it's up there. YouTube is down there. You can look up information, send us email, and let us know what's going on. Then we're happy to do a video consultation and only charge you $60. Then we will guide you over to see what exactly the problem is and suggest you some best acupressure point for you to work at home, right? So some of you may need Chinese herbs or need acupuncture. Now we can't do it at the moment, but hey, we can wait until the lockdown time over. Then you can come in to our clinic and get a proper initial examination. Then we know what's going on with the organs. So you might need herbs, because if it's a chronic problem, you may not just get rid of it just by doing acupressure point or acupuncture. All right. So herbs are much stronger. in this case as well, a lot of people didn't know that. That's because you didn't realize that the organs imbalance actually connect to the entire body pain, right? So I hope this video helped, and just share this video as much as you can, and to get anyone suffer from upper back pain to start to work on here. I'm sure you will get some relief from it. Right? Stay awesome, and I love you all. It's lunchtime now. I'm going for lunch. So see you next time. See you tomorrow. Bye bye.